welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. And today we have a great guest, Tom Leary, Senior Vice President of Government Relations at HIMSS. Tom, welcome to the program.
Thanks for having me back, Tom. It's good to see you.
Awesome, and it's great to have you back. Certainly a lot of things going on the regulatory front. And what caught my eye, and the reason why I asked you back on the program was at HIMSS, which was a great show, by the way, was HIMSS talked a bit about the virtual cliff. And I was hoping that you could tell us a little bit more about, educate our audience a little bit more about that. And let's have a conversation about some of the details.
Wonderful. As we all know, first of all, we're still trying to work through the pandemic. Thanks to, just want to thank all the first responders and the clinicians on the front line for all the work they've been doing. You and I have talked about my sister, a public health nurse, and just the challenges that she's gone through. But one of the great pieces of technology meeting necessity for the pandemic has been the rise of use of telehealth and remote patient monitoring in order to increase access to care in a very safe way for lots of folks, throughout the country. And one of the key issues that was one of the key steps that was taken early on in the pandemic was that thanks to some advocacy by us and other organizations, Congress included in their legislation in March of 2020 waivers that allowed for the Secretary of Health and Human Services to improve the ability for providers and hospitals to be able to utilize telehealth services. So it was prior to the pandemic, very narrowly focused on defined by geographic space, and certain provider types were allowed to utilize telehealth and being reimbursed by Medicare. By Congress granting the temporary waiver to CMS, to HHS, CMS was able to implement some expansion of provider types and geographic locations so that you saw an increase in the number of providers that could utilize telehealth. The types of providers, it's nurse practitioners, physician's assistants, were also included. Pharmacists began using telehealth, et cetera. So what happens, though, is the legislation only allowed for the waiver to be in place until the end of the public health emergency. Now, granted, the public health emergency, which was declared in January of 2020, has been extended every 3 months. We expect the final extension for 2021 to go through December of this year. And the administration has indicated to states that the public health emergency would stay in place at least through the end of this calendar year. But the moment that the public health emergency is declared ended, then it starts a very quick timeline of reverting back to pre-pandemic legislative and regulatory requirements. So that's what we're referring to as the virtual cliff, because all of the provider types, all of the geographic locations that have been utilizing telehealth will have to revert back to pre-pandemic scenarios and won't be able to offer telehealth, which has provided safe and improved access for a lot of, not only seniors, but for a lot of individuals. So what we're calling for is, let's not go backwards in order to get back to where we are so that we can continue to move forward. Let's address and make telehealth and remote patient monitoring services available permanently through Medicare, and then other insurance providers will follow suit. So that's really the gist of it. Is as soon as the public health emergency is declared ended, the opportunity in those geographic locations and provider types reverts back to pre-pandemic scenarios, and we just can't have that as a nation. It's irresponsible for us to have that approach.
This time frame reminds me of my very first computer job, frankly.
Right.
I worked for, I'm going to backtrack here and come fast forward. I worked for UPS, and one of the first projects that I had was automating their telephone center. Believe it or not, when you called UPS back in 1986, they hand wrote every order and
Wow.
had to fax it over to the delivery car, package car hub. So the point there being was that was the CSTC, Customer Service Telephone Center. So the project was ECSTC. But so upon our first launch in New Jersey, actually, the senior vice president came to the dinner and he said, "Listen, we're no longer going to call it ECSTC; it's CSTC because it's just a regular telephone center, even though we use computers." The point there being is healthcare. Just because we use technology doesn't have to have technology lingo embedded in it. It's healthcare, right?
Right.
So, and what COVID taught us, if it taught us anything, is how to reimagine the delivery of care. Before COVID, I'm sure you would agree, telehealth, virtual care was a nice to have, not a must have. I think we validated that it's really a must have element of the delivery of care. And I would agree with you that eliminating the geographic and originating site restrictions truly does allow that home to be that setting of care. Because with the restriction back in place, we revert back to, believe it or not, it's only been 18 or so months, but it seems like we would revert back 20 years.
Right.
And,
Exactly.
And how we think about the delivery of care. I just think that it's frustrating that, and I don't want to get into politics here, but it's frustrating that our Congress isn't being, and maybe they are, maybe we don't know something, right?
There's 10 pieces of legislation. There's a lot of support. Senator Schatz of Hawaii has been very vocal. Senator Matsui or Congresswoman Matsui from California and others have been very vocal with legislative ideas to address the permanence of the telehealth waivers. The big hurdle really has been for close to a decade has been the Congressional Budget Office. They have said that it's only going that access to telehealth and remote patient monitoring will only increase access and therefore increase the cost of care for Medicare and therefore put the Medicare Trust Fund in more jeopardy. When we've come to them pre-pandemic with data showing cost savings for anything from cardiac care patients in southwestern Virginia to pediatrics and other scenarios in Louisiana and Texas, it's different examples across the country. Their response has often been, "That's great that you're showing savings, but none of this data is about Medicare patients." The change that occurred a couple years ago was we were allowed to have pilot programs, particularly for COPD patients, and so we began to get a little bit of data. With the pandemic and the waiver for Medicare, where we now have eliminated, in our minds, the concern by CBO that there isn't data from Medicare on the improved access, the improved safety, the cost savings, the cost avoidance that can be put into place. So we, as a community, 400 plus organizations have sponsored or signed a letter to Congress, are absolutely supportive of the idea of that we've got the data that CBO can now make educated decisions or educated recommendations on the impact on Medicare, and let's get on with making this permanent so we can maintain the access, maintain the innovative approach that we're seeing within healthcare.
I couldn't agree with you more in that, I get the sensitivity to cost. However, if we can demonstrate increased access, and that's what we talk about relative to how to provide better care in the urban settings, how to provide better care in the rural settings. So increase access is a beneficiary to better health, right?
Right.
One would say the more you're able to gain access to your health care, the more engaged the patient is, and the behavioral change and the domino effect around get going along that awareness to wellness continuum. So I'm reminded of Dr. John Woodson, who was an earlier guest on the program.
Mm-hmm.
He talked earlier about. I can appreciate that there's several bills that are in consideration. But if we look at it in the context of an infrastructure bill, right? Let's think, so I think on the last show, the last program, you and I also talked about we wouldn't have been as successful in the delivery of care, creating these multiple access points with telehealth if it hadn't been for the HITECH Act.
Correct. Yep.
So think about, if Congress were to think about what's the next, and that didn't have that wasn't a budget neutral investment, right? HITECH Act was big in many different ways. So
laid the foundation for healthcare transformation.
Yeah,
Absolutely.
Laid the foundation. So what's the next level of transformation, right? So if the federal government was an investor in America, which I believe they are, what would that next level of investment be relative to enhancing data interoperability above and beyond TEFCA and the interoperability rules that are now vastly coming in place, and just the overall infrastructure needed to better support that home becoming a setting of care, whether it's for an ambulatory setting or an acute setting.
Sure, it's you hit the nail on the head in terms of infrastructure improvements, and we can talk for a little bit about public health infrastructure needs as well, but specific to telehealth and remote patient monitoring, it's the recognition by Congress that broadband, the first line of $7.4 billion was put in to help to expand broadband in the United States back in the Recovery Act back in 2009. The infrastructure bill has even more funding, even more recognition, not only from a infrastructure improvement, but also workforce development approach. So it's really a win-win for all parts of the country to expand the level of broadband access in the United States. And we've been part of a coalition for many years that looks at schools, libraries, and healthcare settings needing improved all the way the last mile conversation around broadband, whether it's urban or suburban or rural settings. The more access we have to infrastructure improvements, particularly broadband, we'll be able to continue to deliver this telehealth and remote patient monitoring capabilities. So there is one OB/GYN in West Virginia to support at the safety net level for 5 counties in West Virginia. Very, very mountainous, not compared to, say, Colorado or Utah, but for East Coast, it's a mountainous area. And for pregnant women and family members to be able to go and see that provider, it can be pretty treacherous in particularly bad weather in the winter or rain or fall and winter. The idea of expanding broadband and therefore being able to offer telehealth access, it's improves the access to care, improves the issues around maternal health during pregnancy, improves the likelihood that you're going to have a successful pregnancy and you'll have a healthy baby born. So it's that type of infrastructure investment that is being considered by Congress right now as part of the infrastructure bill that helps out with those, whether it's West Virginia or remote areas of Utah. If you've ever gone to Four Corners, just put each limb in one of 4 states. I don't know if you've ever done that or heard about it. To get there, it's some pretty remote areas, right? And so the idea of being able to bring broadband, and along the way you'll see a sign for a clinic for the individuals, the families, or whatever that live out that way. Bringing broadband to that kind of setting as well raises the level of access, raises the likelihood of chronic diseases being under control, and levels off the cost of care. So those are the types of things, the infrastructure improvements that we would see as being helpful, and therefore plays right into the making the permanent the geographic location waiver that will could be in place. The remote patient monitoring, you see a regulatory activity happening at CMS right now that is anticipating that the public health emergency will end before the waivers are made permanent, and remote patient monitoring requirements going back from 1 day of interaction with a patient to 16 days of interaction in order for the provider to be reimbursed. Yeah. Our CEO, Hal Wolf, likes to point out that Kaiser, 15 years ago, had put in remote patient monitoring when he was there, and they had set parameters. So if the patient's numbers on the remote patient monitoring scale, if it goes below this number or above this number, providers alerted, then the providers engage with the patient. So there's technology that's been in place for many years that can help to monitor when it's if you're below this number, above that number, and versus having to check in 16 of 30 days of the month in order to be reimbursed. That's the kind of additional waivers that need to be put in place permanently so that we can get on with the innovative approaches to care delivery. We do not need to go backwards in order to get back to where we are now.
I hear you. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley. And today we have with us Tom Leary, Senior Vice President of Government Relations at HIMSS. We're talking about the ending of the public health emergency waivers and timing of that, and why and the benefits to the overall health system. So with that, as you know, I am Chief Growth Officer at GDMD, and we do provide a remote patient monitoring platform. And you're absolutely right in that if a patient has a medical device, and let's just say we're measuring for hypertension, monitoring for hypertension, as long as they're taking their vitals, taking that measure, once a day or 16 times within a 30-day period, there's really potentially nothing to do, if you will, because maybe they're exercising and dieting, and there's no out of range measures that are taking place. So. Right. So one would argue that they are achieving the clinical goals of staying within range. But on top of that, the question might be, hey, I'm a diabetic, right? I'm managing my diabetes, but I want to get rid of it, right? That's the flip side of, just because you have diabetes doesn't mean you have to die with it, especially type 2. Right. So, the diet and exercise and, I don't know if you've ever watched the show The Biggest Loser. It's not
absolutely. Yeah.
Right. So, there's the perfect case of they come onto the show with a bag full of pills, and they walk off empty-handed because they've diet, exercised, and got into the right mental state, if you will, with no disparity intended. It's just that they've gotten into a different space relative to what it takes to actually move along that continuum of awareness to wellness. I want to get better. I'm trying to diet myself, and it's hard to lose weight. So it is, and like I said, my father was a diabetic, and all too often the story rings true in that remote monitoring does have its place. And I'll just end by saying telehealth and remote patient monitoring are often maybe what am I trying to say is two ends of a stick, if you will, right? Because oftentimes people think of telehealth and as a video visit, and it's more than just a video visit, right? So I do hope that once the public health emergency ends, and we are now on a path to enhancing the reimagining of care, that we come back to some of the security aspects of eliminating need for HIPAA compliance and things of that nature, and we bring those back into play. Because the point there being is telehealth is more than video. And so oftentimes doctors say, hey, I use telehealth, and we saw an article the other day that says telehealth engagement is actually on the decline, right?
Right.
But remote patient monitoring is on the upclimb. So in the context of virtual care delivery, it is the full spectrum of virtual care. Telehealth is included, remote patient monitoring is included, chronic care management is included, and even in 2022, remote therapeutic management is included. That's the spectrum of virtual care that we need to think about. Your thoughts?
So, agree with you, and I would say it's not just a U.S. concept. I was talking to we're part of a digital health advisory group for Europe, and talking to individuals from I think it was 30 countries within the European sphere, and they were talking about telehealth and remote patient monitoring being on the downslope again, because it's quote unquote, in the patient's minds and providers' minds, it's quote unquote what I did during COVID. It's not thinking about it as this is the next phase of how we keep you out of the hospital, keep you taking care of you within the four walls of your own home, or utilizing the time. So the providers that I talk to that have truly engaged in telehealth, as long as the reimbursement is consistent, and particularly in the U.S. providers, as long as it remains consistent, they feel like they get as much or more out of the visit with an individual, and they're able to truly engage with a patient in a setting that the patient is comfortable with, and all that doesn't even talk about the factors of the patients who have to take off of work.
That's right.
To engage, or they have to take an hour-long bus from this side of town to that side of town, and if they miss their connection, we've heard about folks just in a pregnant woman in the DC area. She missed her bus connection, so she was standing there an extra amount of time, and then it took 2.5 hours to go to the appointment. It was 30-minute appointment, and then the trek back home, because of the mindset of, hey, not all settings, not all provider types can use this in the long term. It puts the patient at risk of not, saying, well, that's too much to get to. 2.5 hours is too much to give for an appointment. So therefore, the patient isn't having the wellness visit. The prenatal visits aren't necessarily happening as timely. So it's those types of things that in getting beyond the mindset of it's what I only did during COVID, to actually this is another part of the care, another tool in the tool chest for really bringing innovative preventive care to bear.
Yeah, absolutely. So, remote patient monitoring reminds me of the ability to provide 24/7 care. Mm-hmm. So when we talk about access and the home becoming the setting of care, there is no better program for 6 out of 10 adults who have a chronic condition to be in a remote patient monitoring program. That said, we all know the ugly statistics of therapeutics, prescriptions. Pick a study, but it ranges from 30% to 50% of all scripts ever written never filled. Right? I've slept to the health system. I saw the doctor. I took the test. I got diagnosed. I got my care plan, the script, and I never go to the pharmacy to get it filled. Right? But to be able to monitor that now in a remote therapeutic management type of program, sure, just enhances the overall quality. So initially, it might cost more because people are more engaged in getting well, right? Because we all argue that we're in a sick, the care management is we are reactive in that. Okay, we let you go. We've let you go 50 years to do whatever you wanted to do, and now you're obese. Now you're this. Now you're that. You got chronic conditions. Now we got to spend money, right? Right. As opposed to wellness starts on day one of birth, if you will. So there's this transformation all in mindset of a wellness delivery system, mm-hmm, as opposed to a care delivery system. So I think HIMSS is doing a great job in advocating the transformation. I always respect and admire the work that you guys do, and hopefully we will be on the forefront of greater transformations in the coming months. We have a minute or two left. Any closing words?
Sure. Just as the debate moves forward and as we convince more legislators to embrace the idea of 21st century care delivery and innovative approach, I think that the having the public discourse around audio and video versus audio only and video only and those kinds of things can be worked out. It's making sure that we continue to progress forward, not going backwards to get to back where we are to then be able to progress. So, that's really the message that we and all of our colleagues across the community want to convey to everyone.
Yeah, absolutely. All modalities are critical because they support different aspects of the care continuum. So all modalities of care, audio, video, high acuity encounters, remote patient monitoring, that whole continuum that I talked about before are all valid in the framing of virtual care delivery and how that integrates to the overall delivery program. So definitely with you. Hey, Tom, another great conversation. I do really appreciate your time, and thanks for your efforts again, and look forward to talking to you on a future program.
Awesome. Thanks, Tom. I appreciate it.
Thank you. I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.